Great. Hello, everybody. Thanks so much for being patient. You would think this is approximately our 200th opportunity to speak with members of our public. You would think that we would have this down, but this is a special day, right? So thanks for being patient. We really appreciate it. My name is Mary Jane Burke. I'm the Marin County Superintendent of Schools. Just to remind you, this webinar is being recorded and being simultaneously translated into Spanish. It'll be available on the website within 24 hours. Usually it'll be on the website by tomorrow at about noon. At this point, I just want you all to know that it's such a great opportunity to have a moment to essentially get all the data we can about where we are right now at this particular moment in time. Where are we around vaccinations? What's going to happen about testing? What are the rules going to be over this holiday break and the return? But I think most importantly, we can all be very, very proud of the fact that Marin County has continued to lead the way, not just in California, but across the country in a variety of areas. And that is a tribute that goes to each and every member of our community, and most importantly, our public health partners. And so at this point, I'm going to pass this webinar off to Dr. Santora and Dr. Willis. Thank you very much.
Thank you, Mary Jane. I'll start with an update on our numbers, and then we'll get to an update with regards to more specifically to schools. Can I have my first slide, please? This is our just overall experience in terms of the numbers since the beginning of the pandemic. Over 16,000 cases in Marin. And on the far right there is a point of particular pride for us as a community. 239,000 residents of our 254,000 residents now are vaccinated. That is the highest vaccination rates of any county in the United States. Next slide, please. This really captures what is most concerning of just over the past week or so, which is that rapid rise. This is our case rates per day over the since the beginning of the pandemic. You see our four surges there relatively clearly. And then you really see what is a fifth surge in cases. This is being on the far right, driven by Delta. This is still 100% Delta variant. And this is really fueled primarily after Thanksgiving. And we think Thanksgiving gatherings were one of the really primary contributors to this. What's important about this, we'll talk more about it in a bit, is that it is not corresponding to surges in people coming into the hospital as prior surges had been. And that's because of the high vaccination rates. Next slide, please. This is the CDC transmission level. This map, we've been sharing this map with you on a regular basis. It was a lot more yellow and orange before. Now it's red. This is really what we're seeing across the nation now as Delta starts to increase in what's being termed the winter surge in the United States. In Marin, we are also in that high transmission red category, as are most other California counties. Next slide, please. What this shows is that the primary risk remains being unvaccinated. On the top there, you see in the orange, the case rates among unvaccinated residents. And now the blue on the bottom, you see case rates among vaccinated residents. And you see that case rates among unvaccinated residents is about 66 per 100,000, or 66 per 100,000 residents on a 7-day average. Five-fold decrease in risk for compared to if you are vaccinated. So the message remains, despite the fact that we have very high vaccination coverage, the message remains, even that small fraction of residents who are unvaccinated, it's important to get the protection of the vaccine because the Delta variant is so active in our community. Next slide, please. Now we'll move on to Omicron. Next slide. This is just a reminder that we are doing regular sequencing of samples across the county. About 25% of our active cases are sequenced, and we are publishing the results online. This is what we've seen so far, and again, just shows that green is the Delta variant. We are actively pursuing samples of returning travelers who have been diagnosed with COVID-19. Thus far, none have been found to be infected with the Omicron variant, but those are expedited samples that we continue to supply to the state and did some more today. So I would not be surprised if we see in the next day or two evidence of Omicron in Marin. I think 5 other Bay Area counties now at least have 1 case. And what we would expect would be sort of a staggering and stuttering experience where low transmission only in travelers who have returned, followed by at some point, perhaps it would gain a foothold with local transmission, and then we would see an increase in cases. And I would be surprised if that is not our experience in Marin and across the nation, in fact, the world in the coming weeks. Next slide, please. This is the global distribution of the Omicron variant. It just shows that, as each day passes, more nations are experiencing cases of this highly infectious strain. Next slide, please. So what do we know and don't know about Omicron? First, we know that it's spreading rapidly from data in Southern Africa, now moving across the globe. We know that it has a very high number of mutations, about 50 mutations, more than twice the number of mutations associated with Delta. The number of mutations per se itself doesn't necessarily mean that it is more serious or more, it might actually, some of those mutations might actually confer less virulence or less severity of illness. But they know that some of those mutations do confer more infectivity, so it makes more likely to spread. And then when we compare that with the epidemiologic data of rapid spread, we know that it's probably just a more contagious variant. Fortunately, common diagnostic tests like our Binax Now and other tests we use for rapid antigen testing in our schools will detect positivity of someone who's infected with the Omicron variant, which will be important for us in the future. What is unknown is the severity of illness, although we're getting more and more confidence that early data suggesting milder illness is really holding true. It does seem to be contributing to much lower hospitalization rates compared to previous variants, which is excellent news. And that the immune protection of the vaccine is still not perfectly known, although there's early data now that the Pfizer booster vaccine does protect against the Omicron variant, which is an early sign that vaccines are conferring protection, which is why one of our primary recommendations remains that people seek the protection of vaccine and boosters. And then finally, the other unknown is that we don't know the effectiveness of the existing treatments, especially the monoclonal antibodies. And we'll have more data on that as more cases emerge globally. Next slide, please. These are hints from South Africa in terms of the behavior of the Omicron variant. What it basically shows relatively dramatically. This is similar to the chart I just showed you for Marin. This is the strains that are prevalent in South Africa. On the far left, what you see is the green, which is at that time, it was the beta lineage, the beta variant dominant in South Africa for a period of months. Then it became the Delta variant in South Africa. And then on the far right, that sliver of blue is the Omicron variant. And it emerged very rapidly and within a period of about 10 days actually became the dominant strain. It's about 90% of strains in Southern Africa now are the Omicron variant. So very effectively elbowed out what we knew to be a very contagious strain, which is Delta, which is an important sign of its infectivity. Next slide, please. This is also a point of reassurance for us of its lack of severity compared to other strains. What this shows is the dotted line shows the different waves that were occurring in South Africa over time. They had waves just like we did. And then on the solid line on the bottom shows the waves of death rates. And then you can see that those death rates sort of follow those waves of case rates in a reliable way for the first 3 waves. But then on that 4th wave, which is the one that we're currently seeing in South Africa, which is the Omicron variant, the death rates have not increased. In fact, they've continued to decline. And this is the kind of data that we're looking at internationally that offers that reassurance that Omicron is less virulent. Next slide, please. So important question people ask, with this coming, what are we doing differently or what can we do more? And the fact is that there's no new strategy for us to employ here so much as just really doubling down and doing the things that we know are effective even better. So getting vaccinated or boosted is the most important thing you can do if you're concerned about Omicron. Wearing a mask in indoor public settings remains a strong recommendation from public health. And we've seen that 80 to 90% of our residents, when we go to grocery stores, et cetera, elsewhere, are continuing to cover their face. That's important. Getting tested. We want people to recognize that if they have sniffles, allergies, flu symptoms, things they may not recognize as as COVID-19, because we have such high vaccination rates and vaccines lead to less severe illness. Mild illnesses can actually be COVID-19. And we found that people misunderstand their symptoms sometimes and will actually enter into congregate settings or go to work or go to school with mild symptoms when in fact they have COVID-19. So we really want to make sure that people test for symptoms if they're having mild symptoms at home and stay home. And then obviously just stay home if you're feeling sick. Next slide, please. So now go to the vaccine update. Our vaccine goals in terms of our just highest priorities were 75% of all eligible residents age 65 would have a booster shot, and that 75% of our newly eligible children age 5 to 11 would have their first dose by the end of December. We've extended that because we hadn't achieved the goal by having that by December 5th. We are making good progress. So we want to keep our eyes on that prize and continue to work towards that goal. Next slide, please. These are our vaccination rates across the county and basically shows what I've already said, that 239,000 of our residents have received at least one dose, and over 80,000 have received that third dose or that extra booster dose. Next slide, please. This is how we're doing with regards to our older residents. 70% age 65 and older have received a booster, so that's almost 40,000 residents. We're hoping to get that last 5% by in the next, how many days do we have left? We've got about 10 days to get to that goal, or 6 days. It was the 15th, so we got to do about 1,000 a day, but I think we'll get there. We're opening more appointments for older residents to receive booster doses. This is an important strategy because we know when people who are older do get infected after they've been vaccinated, they're at higher risk for ending up in the hospital. Next slide, please. This is how we're doing with regards to our children. 62% of our children age 5 to 11 have been vaccinated, over 11,000. That number is probably over 12,000 now. The number every day, the numbers continue to rise. And this is by a large margin, the highest percentage of children in that age group vaccinated in the state of California. Next slide, please. There was a LA Times story about our vaccine success. Marin is sort of emerging as a Cinderella story around vaccinations, having had much lower vaccination rates, 2014, 2015. Now we are the most highly vaccinated community, which has gained some nice attention towards all the work that all of you as a community and our partners, the Marin Medical Reserve Corps and others that have stepped forward to remove barriers to vaccine. This is one of the quotes from one of our parents that was in the LA Times. My 11-year-old daughter was vaccinated at a county vaccination center in what used to be a Victoria's Secret store. I'm still laughing. Life can be hilarious. Thank goodness for that. And that is where we are. We are at Victoria's Secret at Northgate, and that's just kind of how we roll. We find ways to make this happen. It's actually a nice. Many of you may have had an experience of getting your vaccines or your children's vaccines there, and it's kind of soft pink lighting and a relaxing setting. Next slide, please. So today's announcement, Pfizer boosters for 16 and 17-year-olds. It's 6 months after the second dose. What's different about 16 and 17-year-olds? There's no more mix and match options because they're only approved for the Pfizer. Important considerations. It's brand news. For us, we're still considering how we will be rolling this out in Marin and the strength of our recommendation for boosters for this age group. So considerations that we'll be taking into account and you should be aware of in your own decision-making now that it's an option, is that we know that 16 and 17-year-olds have a much lower risk for hospitalization if they are infected at baseline. That's been true with COVID-19 all the way along. We know that they've also been more recently vaccinated relative to our older residents who were vaccinated in January through March. Our 16 and 17-year-olds were vaccinated in May, June, July. So they're vaccinated more recently, so there's less waning immunity. And then when they were vaccinated, they actually had a stronger immune response. We know that from the studies that adolescents in these trials really mounted a very robust immune response with high levels of antibodies. So they start off better, they wane less quickly, and they are lower risk for hospitalization to begin with. At the same time, we are seeing case rates rising in this age group. So these are factors that we're going to be taking into account with regards to our recommendations. Next slide, please. Here's just a graphic illustration of what I already shared, which is in Marin County, on the orange line, you see the numbers of cases every day over time. You see our waves. And then in the the blue line, you see our hospitalization rates. And what you see is that they track relatively closely in that first wave, the second wave. But here, as we come to the right, which is the current times, you see that surge in cases that we just had. We're continuing to see lower and lower hospitalization rates. So the distance, the difference between case rates and hospitalization rates continues to be important and grow. Next slide, please. This is what I mentioned about this recent spike in adolescent cases. Whenever we see a spike in cases, our first question is what's driving this and what populations are affected. And on the right here, you see the red line is our residents aged 12 to 18. And you just see that really kind of almost vertical spike in the number of cases among people in that age group. So our adolescents are being affected at very high rates. And Dr. Santoro will talk more about what's actually fueling that in a bit. Next slide, please. Mask update. Next slide. So the state mask mandate, just to remember that masks, the Marin County had a local mask mandate, and the state of California is one of 9 states that has a state mask mandate. And that state mask mandate is still in place. And it is that masks are required on all public transport, in healthcare settings, K through 12 in childcare settings, correctional facilities and shelters. So K through 12 in childcare, masks for everyone are required in schools as a state mandate. Masks are also required for unvaccinated persons in indoor public settings like grocery stores. Marin County Public Health strongly recommends vaccinated persons cover their face in indoor public settings. We removed or lifted our mask mandate when we met criteria to do so a month ago in Marin County. That was the mandate, but we reverted from a legal obligation for everyone to cover their face to a strong recommendation. Next slide, please. So the criteria that has just come out by Marin, there was a press release on this today, that we will be looking to for restoring our local mask mandate is going to be based on hospitalizations and not case rates. And the number will be 5 hospitalized for COVID-19 per 100,000 residents, which in Marin is 13 patients. So that's a way for us to really trigger, not to be too sensitive to rises and falls in case rates, because we know our cases are often primarily people who are vaccinated and are experiencing much more benign illness, not ending up in the hospital. So we're really wanting to make sure that our focus is on the things that we are most concerned about, which is severe illness and death. So we're pointing now to hospitalizations as a trigger for our policies. Our current status is there are 4 people hospitalized for COVID-19 in Marin, and we do have daily reporting from our hospitals to track this over time. Next slide, please. And just to reiterate, it's just hospitalizations is simple and easy to measure. It's accurate. We get daily reports. Our cases are increasingly mild. And we also recognize that as we're promoting home-based testing, that we may, not always see cases. We want in our school community, especially for people to report cases to us when they have the home-based test. We'll talk more about that in a minute. We also know that the home-based tests are flying off the shelves in pharmacies across the county, and that our view of the results of those is limited because they don't automatically end up in our reporting structures the way the laboratory-based PCR tests do. Next slide, please. Holiday recommends. So there was just one question. What do we recommend for the holidays? It's simple. So unfortunately, one important parameter of safety is vaccination, and that if you're unvaccinated and you're with others, you're putting those people at risk. So we're recommending that people who are hosting gatherings to limit those gatherings to fully vaccinated persons. Also, rapid antigen testing on the day of event. That's been our practice. We did that on Thanksgiving in our household, and make sure that you have tests, and you can test people either on site or ask people to test on the morning of that event before they come. It's a simple and effective way to rule out infectivity, to make sure that person is not actually infectious to others on that particular day. Gathering outdoors as much as possible, and of course, as I said before, staying home if you have any symptoms and doing that test. Next slide, please. So on with COVID-19. Actually, now I'll hand it over. It says schools. So
I'll take on schools is my bailiwick is schools. So hi everyone, I'm Lisa Santoro, Deputy Health Officer. And we have been getting more questions around the vaccine mandate. The governor issued a proclamation in October that California would be leading the nation in implementing mandates for staff and for students once there was regular FDA approval of the COVID-19 vaccine. And we have regular approval at this point, but it's only for adults at this time. And so we have seen some school districts across the state implement mask mandates, but that is not based on a state requirement at this time. And so what we're anticipating is that it'll be effective in the 2022-23, time has flown, school year. That is when the state mandate will be coming into effect. What's different than this mandate versus our SB 277, which is the requirements for childhood vaccines for school entry, is that a personal belief exemption will be allowed. And we are still waiting for to see instructions from the state on how that will be implemented. The primary resource for us and for the community is a website called shotsforschools.org. And that's where you can get your most up-to-date information from the state when they start rolling this out. That being said, and I mentioned it earlier, the governor did encourage school districts to institute local vaccine mandates, even though at this time we don't have any local mandates in Marin County. Jump ahead. So we sound like a broken record, but it's true. It's get vaccinated or boosted. We really see a big difference in your risk when you are not vaccinated, and we see increasing protection for those who are boosted. We shared data with you on how many individuals over the age of 65 are boosted. What you would see based on each age group younger than 65 is it's a decreasing trend. So the younger you are, the less likely you are to have a booster shot. And the recommendation from the Centers for Disease Control and from the state changed last month, it's December, so last month, to recommend that everyone over the age of 18 get their booster shot. And again, we'll be issuing our recommendations around the booster recommendation for that 16 to 17-year-old population. When you're indoors, regardless of your vaccine status, especially if it's a crowded setting, it's recommended to wear your mask, strongly recommend to wear your mask. And just to be reminded, when you're traveling across the Bay Area, you are traveling into counties that still have a mandate in effect, regardless of vaccine status. It's always best to have those masks on hand. Jump ahead.
Oh, this, I just wanted to, sorry. This happened, I thought it'd be important to share with our community, which was the Surgeon General's advisory around mental health. And he basically identified, crises of mental health among our young people, and identified that the pandemic has really exacerbated existing issues with mental health and access to mental health services among young people. And his quote is, "It would be tragic to beat back one public health crisis only to allow another to grow in its place." Next slide, please. And I thought this was important framing that is included in this document from the Surgeon General, and really signals kind of our, I think we're looking at this collection of partners that have come together for COVID-19 pandemic, and the relationship we formed with Marin County Office of Education and our healthcare partners in public health has been so effective in our COVID-19 response that we recognize we need to stay together into the next stage of recovery. And that will be a lot around addressing the mental health needs of especially of our young people. And this construct here that's illustrated, it shows that there's these concentric layers of support in which we live. There's the individual, there's the family, and all of these need separate forms of support. There's the community in which we live, the environments, environmental factors, and the overall society. And in Marin, that's been the way we've been approaching the pandemic response, recognizing that social inequities at the societal level have driven disproportionate impact in some communities. So our vaccine strategies have been really aggressively focused on low-income communities, all the way down to the individual and supporting families and communities. So just wanted to sort of flag this as a signal for ongoing relationships and ongoing prioritization of addressing the mental health consequences of what the last year and a half has been, especially for our young people. Next slide.
And I just want to add to that, I think so many people have been traumatized. This is now going on 2 years, and we have people who have been traumatized because of loss of work and loss of employment. People who have been traumatized because of being on the front lines and working every single day, it feels like, and people who been traumatized, especially our younger children and adolescents, by having their entire world disrupted for now almost 2 years. And I think our focus in public health and as we move into 2022 is really recovery and really trying to bring the supports to individuals and to families so they can have, have the conversations they need and to seek, I think most importantly, to seek additional help and supports when they're finding that their children or adolescents may have more trouble navigating this new normal for them. And I think a lot of children are resilient, and that's, I think, one of our amazing characteristics of children and adolescents is their resilience, but many of our students are still just struggling to adapt to their new normals and the new environments of which they're learning. So,
and maybe just to add, I think everyone's aware that every school, public, private, independent, parochial, has had public health liaisons that essentially have been in meetings every single week for the last 2 years, where they have essentially been the people at the school site, if you would, boots on the ground, related to COVID response. And in the last several meetings, things have begun to shift a bit where we are adding into those meetings additional information about mental health, opportunities for training, et cetera. So do know that, as Dr. Willis and Dr. Santora have framed much of what has happened, there is such a strong foundation that we will continue to use it into the future. And then also to note that this situation has also affected adults. And so regardless of role in the community, it might be someone who happens to work in a school, in a hospital, in a restaurant, just any member of our community. And that's why this week, as you, I think, hopefully are well aware, is Wellness Week Marin. And so we've had over 1,000 people participate in the activities, either live or over recording. And we're very pleased by this. So for those of you who haven't had a chance, be sure to sign on tomorrow morning at 7:45, a 15-minute increment, but also tomorrow afternoon at 3 o'clock, you'll be able to see Dr. Willis, Dr. Santora, Sergio, our colleague, myself, and Pat Kendall will do the YMCA song as we get ready to provide the gift certificate prizes to participants in the county. Back to you, Lisa.
all right, you can jump to the next slide. So we are preparing to enter into a holiday season. I know everyone is just mustering to get through to the 18th, and this is not a time to let our guard down. As many of you are aware, we're seeing an increase in cases in the school environment because of the activities over the holiday and that surge in cases, especially among the adolescent population of our community. So it's just really critical that schools and parents are ready to report positives during the holidays. It's required to report positive cases to your school, and there are ways that you can report that, and we'll have our checklist. So we'll just make sure that you check in with your school before you go away on break and ensure that you know what are the right reporting instructions for a case that might be identified in your family during the holidays. So even if you're on a holiday, you still need to report cases. Jump ahead. And just again, to reinforce our parental or guardian responsibilities, you have to stay home when sick. And it's just to remember what we've been seeing is not only COVID circulating in our community, but other illnesses circulating in our community. And just if you have a negative COVID test, if your child or student is still sick, they should stay at home while they're sick. We have our test or 10 requirements. So if you have symptoms of COVID-19, you have to get tested in order to return to school. And if you don't get tested, you need to stay at home for 10 full days in isolation. Just again, reinforcing the critical importance of reporting positive test results to the schools. And students who do test positive have to stay home and isolate for the 10 days. And unvaccinated household contacts and unvaccinated social close contacts must quarantine for at least 7 days. And then this is another reinforcement is we've already seen our CDC travel guidance change. If you are traveling internationally, make sure that you do follow check the travel guidance from the CDC before you return to the United States. Most notably, we've seen that there's a new requirement, regardless of what country you go to, you need to get tested 1 day prior to the return to the United States. So make sure you plan that out, something you didn't have to do when you were planning your trip out of the country just a couple of weeks ago. So make sure you stay up to date. Jump ahead. Masking in youth sports. So we are seeing significant amount of activity in COVID transmission in our indoor youth sports, especially basketball. It's been a primary driver of cases in our community. The state updated its guidance. We are not changing our recommendation. Masks are required indoors at all times during heavy exertion included, unless there's a choking risk. What the state did do is they added a phrase that creates a door to not wear masks, and they added the phrase as practicable. And we've seen a lot of our sports choose to see that playing indoor basketball it is not practicable to wear a mask. We disagree in public health, but we understand that that's allowable now. And so there's new recommendations if you are going to be allowing players to not wear masks during play. And our biggest concern is just because of the high number of cases that we're seeing connected to indoor sports. So you can jump ahead.
Just right now, I think we have at least, oh, there you go.
Yep. So just reinforcing, this is one of, among the adolescent cases that you've seen, many of those, probably more than half of them are connected to indoor sports and competitions about multiple high schools. We're managing 5 outbreaks with more than 20 cases related to those outbreaks and more than 200 close contacts. So it's a significant burden to the school. It not only interrupts sports play, which we know is important in our community, but it interrupts academic and attending school. And so again, we strongly recommend that people find the practicality of wearing masks during indoor play. And also remember, it's just not the play itself. During the play, there's a higher risk of COVID transmission because people are exhaling, especially you can have asymptomatic, especially in a younger population, you can have asymptomatic carriers who are vectors for COVID-19, but also the social activities that surround. So when individuals are carpooling together or they're going to after game parties and events at homes, those are all events that can drive infection and transmission. So really, we do have tools to decrease that risk. Again, we are strongly recommending that if you're going to not require mask in play, that you implement a weekly testing program for all participants, not just the unvaccinated participants, which was our previous recommendation. And also importantly is to communicate your policy with the competing team before you compete. So everyone is on the same page and understanding and not caught off guard. So you can all be able to enjoy the game together and not have other dynamics where teams are frustrated by the policies of different schools. And you can jump ahead. And just as also state, we have had to cancel games because of COVID transmission in specific teams. So it's a risk. So implementing testing is one strategy to prevent a potential game transmission, game cancellation, and also potentially affect participation in tournaments. We know that, especially for basketball, winter tournaments are part of the culture of basketball. So testing is one of the key tools that you can use so you can ensure ongoing play throughout the winter. So on to testing. Testing really is going to be our pathway out of a pandemic and into endemic circulation and to adapt to this new normal. It is the expectation that all schools in Marin, private, public, independent, and parochial will be onboarded into our state K through 12 testing program before the start of, before the return of school in 2022. This is essential for us. It maintains access to free COVID testing, which we'll talk a little bit about later. And our community is going to benefit from this free testing access. So we really need our schools to get on board. We have an amazing joint team effort between the Office of Education and Public Health. We have called SORT, our School Outbreak Response Test Team. They are here to support all the schools onboarding into the primary health platform. We support outbreak testing itself. And again, we have a kind of a concierge level service to make sure that our schools have optimized their testing. And we've tested in one way. We've tested on symptom-based testing, but our future, we hope, is using testing to shorten quarantine and even possibly isolation periods as we move through this pandemic. So more testing will allow us to increase access to schools and instructional time for students. So that's our primary goal, is making sure we have access to free home-based testing in the next school year, or in 2022. Jump ahead. So this is the exciting news. So we have an amazing team. Mary Jane's gonna get a sample. We have an amazing team. There was an opportunity from the state to acquire more home-based rapid antigen test kits. And we submitted some quick thinking from our schools team. Mike Grant submitted a request for the population of Marin County students, and we have secured a kit for every student in Marin County. We're super excited. It's a big win for us. So we will be
And staff,
and
every
staff.
student and staff member.
Very exciting. So we'll be working with all the schools over the next week for them to pick up these kits and to distribute them to families across Marin County. Our goal is that you will use one of the tests. There's 2 tests in each kit, but you'll use one to test the day before you return to school in 2022. And then you'll keep the other kit on hand if anyone in your family or your student becomes symptomatic for COVID-19. And so this app provides us another layer of protection through testing. So we're super excited about having access
And so
to this.
just to add to that, for our large districts, Novato, San Rafael, and Tamalpais High School, their tests are actually being delivered directly to the district. For everyone else, public, private, independent, parochial, the tests are here at the county office now. And so we are going to be looking to move those out into our school districts or schools so that these can be in the hands of our students and staff before they leave for the break. So we'll be under a fairly mission critical distribution timeline to get these out to be sure that they get home. So as Dr. Santora said, there'll be two tests in each of these boxes. One of them is to be saved for the day before the first day back in school. And the other will return to be used for symptomatic testing in the event that someone has a symptom, and then we'll return to our typical structure around testing for symptoms. And we will hopefully be able to continue to maintain a supply.
And we absolutely expect to see the same rise in cases that we saw last year. Our behavior isn't changing. We know people are going to be gathering. This is the primary driver of transmission in our community is private gathering. So like Dr. Willis recommended, using testing on the day of a private gathering is a great tool. And now we have a new tool in our community that we will be able to test individuals returning into school the day before, so we can hopefully identify cases, have early identification of cases. So this is a tremendous resource, and it's because of our relationship with the state and participation in the state testing program that we were able to secure access to this.
Right. And remember, one of the things that I think has helped guide us through all these months is that we have always, as a community, raised our hands with the state. And so this all sort of started with our county being a pilot for the antigen testing. And the result, as it has been on several other issues, is that we lead the way, we work it out, we figure it out, and then the rest of the state follows. So I think that's great in terms of we haven't been risk averse. We've been riding the rails successfully. So I think it's wonderful. And now we have all these tests. It's fabulous.
And it's a great asset for the state is super committed to getting kids into school, keeping kids in school. But they rely on communities like Marin to be early adopters and refine those strategies. And it benefits us because we actually get the equipment and the resources we need to do that. This is over 40,000 kids that are coming to us for this particular effort.
Exactly. It's unbelievable.
There's going to be a lot of elves working in the next
No,
week.
exactly, to get it out. That's perfect.
Santa's going to be very busy in the next week. All right, you can jump ahead to the next slide. You want to summarize? This is our last slide.
Sure. Yeah. So our case rates are increasing post-Thanksgiving. Delta variant remains the dominant strain, but Omicron is expected to emerge soon. We really just need to stick with the fundamentals at every stage in this pandemic response, and we've refined those and do them well as a county. Vaccination is protecting us as an individual and as a community. We're shifting towards hospitalization-based criteria for pandemic policies rather than measuring case rates per se. And safe schools remain our top priority. And we've talked about optimizing testing, vaccinations, and masking policies to keep our schools safe.
Great. Okay, so I think we'll move into some questions, but I do want to start with a comment. One of the places that there's been a lot of news, not just locally, statewide, but national news related to the situation where a parent sent their child that had tested positive into school. And so I would just ask everyone, as you think about that, think about, well, first of all, that was obviously a serious, very serious situation. But it was because of the protocols that we have in place that the information moved forward, number one. And we had 40,000 students and 80,000 parents. And this was a mistake by one person. And so let's be sure that we note that we have been following protocols, we'll continue to follow them to keep our community and our students safe. So everyone can just sort of hold that thought as we move through so much focus on that. And I guess the other thing is that on the very day that broke in the news was another published study about Marin County that verified that based on the data that students and staff were in fact safer in school than they would have been out in the community. In other words, students in our schools has helped to lower the rates of COVID. And that was something that Dr. Willis and Dr. Santora had noted on several of these calls. But to have another published research paper that says, actually, that is absolutely accurate, I think is another example of we don't just follow the state's research or the national research. There's data being collected here that's used to help us be better and stronger. So I think that's great. All right, I just want to start with a couple of questions that came in advance. When do you think we'll be dealing with vaccinations for the 0 to 4 range? This is coming from parents, but also many of our preschool and infant care providers. Any thoughts about that?
Not until spring.
Okay.
2022 would be probably the earliest.
Early spring. And I think also it will be different than how we're distributing vaccines now. We have mass vaccination efforts, and vaccination of children under the age of 5 will primarily be done in their doctor's office and their pediatric offices. So we have very strong partnerships with our family docs and pediatricians in our community, and that is the best place to vaccinate. It's challenging to vaccinate a 9-year-old sometimes. So the best place for anyone under the age of 5 to get vaccinated.
Not Victoria's Secret.
Not Victoria's Secret.
Not for a little one. There have been some, I guess, questions. There was a slide actually about what could happen that would put us back into wearing masks more frequently. Could you describe the conditions that could come into play from your perspective that would have our students not have to wear masks indoors?
Well, there's two levels there. One is the policy itself. I mean, right now we don't have the choice to make that decision independently as a county because it is a state requirement that everyone cover their face. So, if it would be a local decision, if and when the state lifted the mandate, then we would have a decision, do we want to maintain that mandate in Marin or not as a local order? And I think the things we'd be looking at there would be community transmission rates, the things that we've been looking at all along to determine the safety of our policies. So looking at community transmission rates, looking at hospitalization rates, and determining whether or not this is something we want to use in Marin. The fact is, I think Lisa and I both recognize that facial covering is a simple and available and super effective strategy for preventing transmission in classroom-like settings where you really are focused. You've got people together indoors for hours at a time. I think we'd have to see evidence of very low risk and very low community transmission hospitalizations to feel safe releasing that particular element of our policy.
Well, what's your answer to this question? I got my first dose, my second dose, and my booster, and now here I am identified having COVID. Why should I even have bothered?
Because you're not in the hospital, right? I mean, that's the simplest is that the vaccines never, really promise to prevent infection. I mean, that's not most vaccines. I mean, flu vaccine, a lot of vaccines, really the goal of the vaccine is to keep you healthy, right? And we know that you can be infected if you're vaccinated. So that's I think a common misunderstanding, and it's often cited as sort of a limitation of the vaccine that people are getting infected. They're actually incredibly effective at what we really care about, which is preventing severe illness and death. And that would be true even for, if you've been boosted. We've seen people who are unboosted and fully vaccinated are at higher risk. And then you add just another layer of protection. If you get that booster, you're even lower risk. So that's the.
Might this just continue? Then there'll be another booster?
Potentially, I mean, there could be, an annual, like we have an annual flu shot, especially as we start seeing more variants. It could be, year by year, a vaccine that's sort of tailored to the circulating strains of that particular COVID-19 variant.
What about test kits for preschools?
We'll be working to, we've worked with distributing test kits to preschools and childcare. They're an important environment for us. There's more constraints in that environment because of the age of the kids and what's allowable and recommended. So where we can have an 8-year-old self-administer a COVID-19 test, we don't have the same self-administration. So there's different guidance there. So we are working on developing that capabilities and having parents, for example, at drop-off be able to self-swab their child. So it's just more complicated because of age, but it's a more vulnerable setting for us because, and this comes up a lot, why are kids in preschool and childcare not allowed to have modified quarantine? It's because of the nature of that environment. It's an unvaccinated population due to their age and development. They can't maintain any distance and wearing a face mask is limited. So it's one of our higher risk environments for outbreaks. And we have had outbreaks. It was one of our more common settings for outbreaks. So that's why the modified quarantine is only for the TK through 12 grade levels.
And I think that the reminder on that is that, from the very beginning, the sector that was open and the first that we opened was in the early childhood, right? And so these are people who have been working every single day, right, full time with kids. And so anything that we can do, I think, to make sure we continue to recognize that group, but also whatever else we can do. And I know we're working with resource and referral to do that, but we'll do our part when it comes to that.
And our team goes on site and offers testing when there is exposure. And also for many of the childcare facilities in our county, they're not under our jurisdiction, they're under California Department of Social Services. So they have different guidance and different requirements to maintain their licensure. So that's another rate limiting step.
But there are things we're all doing and continue to do to protect those settings, which is, the virus moves through the community and it affects anyone that it exposes. And when more of us are protected. So if that only remaining subset of people that are not vaccinated are those 0 to 4-year-olds, and everyone else is vaccinated, they're really well protected because it's about 5% of our total population. So that would be 95%. So we all actually can continue to do our support, our part to support that environment by doing everything we can to prevent transmission.
And encouraging staff in those facilities to get their booster shot. That's probably the most important tool that's available to our childcare settings to prevent outbreaks and disease transmission is every staff person, everyone who is eligible, both in the family. So if you have a preschool child, making sure your family is fully vaccinated and then and boosted if they're over the age of 18 or potentially 16, 17. And then making sure all of the staff at all the facilities have received their booster shot going into Omicron.
Okay, how about Mike Grant or Melina? Could you go ahead and identify some questions that have come from our viewers, if you will?
Yeah, so there's been some questions both in the chat and that came in advance. But so with Governor Newsom's announcement for vaccine mandates that we know is coming, and Omicron is on its way or it's already here, is there any reason to delay the mandate? Why do we wait to enforce this? Can we at least start a mandate for indoor sports?
A mandate for what? Vaccinations?
For a vaccination mandate, yeah.
We have been strongly recommending requiring vaccination for participating in every high-risk activity. As we move into the new year, we will be considering additional vaccine recommendations or mandates to protect these higher risk settings. And I think there's always a balance in public health of when do you use mandates and orders and when do you allow individual choice and provide recommendations. We've been fortunate and have had a privilege because we've had very, very high vaccination rates that we did not have to initiate mandates or requirements because we had high rates of vaccination among school staff. We have high vaccination rates among our adolescents, and now you're seeing higher vaccination rates among our 5 to 11-year-olds. But it's something that we'll be reevaluating and considering as we move into the new year and look at as you're on holiday, we'll be following data and our both local, regional, and state data as it relates to Omicron, and it begins merging into our community. Also, the data and researching showing effectiveness of boosters and vaccine against Omicron, which is a new variant. So early research is promising, but it's we like to have a stronger body of evidence before we move forward with more mandates and recommendations.
Yeah, and just to tie it back to the hospitalization rates, we are, to take that kind of more restrictive policy, we would look very seriously to see what is the consequences of what we're currently seeing, and where are we seeing, what's the yield of any given more restrictive policy, and that would be important to recognize kind of what we're seeing in terms of the harm. And so that's one of the reasons we're looking at hospitalization rates. If we do see surges in hospitalizations, and we know that unvaccinated individuals are contributing to that, that really is an important sign for us that we need to take the public health action to close that gap through a mandate. And that's the kind of logic that we apply.
There's a question about, what's the end game? When do we get to declare an endemic and move on from this stuff?
Omicron might be the pathway to that. I think we are really we're going to be following it closely. There's so many unknowns for how it's going to behave in our community. We are seeing those hints from South Africa, seeing high infectivity and low virulence or severity, and also that the vaccines do offer partial protection, but not full protection. But I think that's what we're going to be seeing in this next couple of weeks to months, is the behavior of Omicron as it moves into our community, which is what we expect. And how does it behave differently here in a very vaccinated community as opposed to communities that have lower vaccination rates like South Africa did? So it's TBD.
Okay, I know we're a little bit past 5, and there's we started a little bit late, but there's a couple questions related to a household with multiple kids, and one student is either experiencing symptoms, has a fever, and is quarantined or stayed home, and our decision tree permits other students in the same household, if they're asymptomatic, to go to school, but the pediatrician says, well, maybe you should stay home just to be safe. If there's conflicts between the decision tree and the pediatrician.
Well, I think what parents might be experiencing is what doctors are on the front line and seeing Omicron emerge and seeing breakthrough infections, and wanting to sometimes err on the side of caution. And we have the decision tree. It's driven by both vaccination status of students and the ability to isolate safely in the home. We know the household is a higher risk for transmission than the school environment, but we also know that the protections and layers of protection we have in place in the schools, even when a student does come in, we've seen this infected with COVID-19, there's very limited spread in the school setting because of masking and all the other layers of protection that our schools have endeavored for 2 years to put in place. And so we really, especially when in such there is a very mild disease, ideally every teacher and staff is boosted, so the risk of any infection would be low for that group. And we want to limit the amount of time that a child is missing school. Our kids have missed way too much school, and it's really trying to balance the risk and benefits of very strict quarantine and modified quarantine. All that being said, we're going to be reevaluating Omicron. Just like Delta was a game changer for us, Omicron may be a game changer, and we'll be developing new recommendations with Omicron as it emerges in our community. And we're prepared to probably provide an update prior to the school return, or as soon as school returns, based on what we've seen, and then what we see happens over the holidays. And that's honestly where we are.
Yeah, that particular policy of modifying quarantine versus classical quarantine, I think, is frankly controversial. It's something that not everyone agrees with. The CDC recommends modified quarantine as a safe strategy to limit lost days of school. The Surgeon General's report about the mental health consequences of this pandemic, especially among young people. I mean, there's a lot to take into account here, and I think reasonable pediatricians may err on a more cautious element and use that in their own clinical decision and guidance. So we recognize that some people actually don't always agree with what we see as evidence-based strategies, And then it's up to that family to navigate their choice based on where they're getting that information.
And just to add to that, last week we hit the about 3 million mark of the number of student days. And just to remind everyone, it took us till the end of June to hit that number last year. And at this point, I think we're still at just 46 potential suspected in-school transmissions, just to give you a sense of where we are in terms of the data collection.
Yeah, our local experience is modified quarantine has been very successful. It's very low risk because of masking, again, those other strategies, and it's beneficial for the students. And it's, again, we cannot have a zero risk environment, but the harm of being excluded from school for a mild disease when the majority of the school community can be now fully vaccinated. And I think, again, that's what we'll be looking at is we'll be in a highly vaccinated school population, students and staff, but we'll have a new variant with new behavior in our community, and that will drive updates in our recommendations. We don't have it's still unclear.
So do we have time for one more final
sure.
question? So with the new news for the 16 and 17-year-old boosters, can you provide clarity? If it's been 6 months since their second shot, are you recommending advising boosters for 16 and 17-year-olds?
Yeah, I can take. Yeah, I mean, yes, we are recommending that all eligible residents obtain booster shots. I'm also recognizing that not everyone is at the same level of risk, and that on that continuum of risk among those who are eligible for booster shots, the 16 and 17-year-olds are at the lowest level of risk relative to our 65 plus, who are at the highest level of risk. If we define risk as if you're infected, your risk for hospitalization or death. So yes, the answer is the CDC has verified the safety and efficacy for that particular age group. We know that we're seeing cases in that age group. We have now more vaccine appointments available. So yes, we're recommending that our 16 and 17-year-olds do obtain the booster dose. But I also want to, those considerations that I offered, I think are important to take into account. I would recommend a conversation with the healthcare provider.
So as we close this afternoon session, just to make note, reminder this weekend, Strawberry Point School, Saturday and Sunday. Vaccinations for our 5 to 11-year-olds. Walk-ins are welcome. The next weekend, Saturday and Sunday at Novato High School, we're still looking for a few volunteers. And if you're by chance able to help support these vaccination super pods, we would appreciate it very much. And thank you to everybody some people have worked every single vaccination pod since January, right? So we've got a lot of people in our community that have done so much. And I just want to say thank you to everybody, hoping everyone has safe, relaxing holiday. Be safe, follow the protocols, wear a mask, wash your hands, test if you bring people into a group, and enjoy. We have much to be proud of, and we still have a lot to do. So thanks, everybody. Bye.
Thank you. Bye-bye.